lovely to meet you all. I think it's really healthy to build on the slightly brief intro. I'll start with myself. I'm Yara Alenazi. I'm an investor at MassMutual Ventures. I dub myself as a runaway scientist, so I've been in this space, absolutely despised the walls of my lab, and decided to run away to the venture space, and have been investing in healthcare for the past 5+ years. I currently lead healthcare and biotech investing at MassMutual Ventures. We're a multi-stage global VC investing not only in health, but also in fintech, as well as B2B and cybersecurity. We're currently deploying out of our third fund, and in terms of healthcare, we are very driven by what's next in health, and that's a lot of emphasis on tech. It's a lot of emphasis on data, so when we talk about challenges, I think we see it time and time again, but hopefully through this panel, we'll be able to discuss quite a few of those points today, but I'll hand it over to my panel to give a bit more words about themselves.
Thank you. Good morning, everyone. Andrew Miles, background predominantly in big pharma. Then I made a move to technology to Google a few years ago, and very recently got approached by UK government and some of the leading scientists in the UK for our future health. As a chief business officer. For those of you that don't know our future health, essentially the question that it's trying to answer is pretty much what we saw in the previous session. Can we bring data together with technology to be able to create a research and collaboration platform to drive improved prevention strategies in the UK and potentially beyond as well? And to do that, you need the data. The aim was to recruit 5 million participants. This started 2 years ago. We're now at 2 million participants who have given their genetic data, their link to their NHS health records as well, to create a trusted research environment for us to be able to really start to drive improved prevention strategies, as currently most of them are oriented towards illness. So looking forward to discuss today, other strategies that can be approached.
Very good, thank you. Is Google and Future Health connected, or there is nothing?
They're not connected.
Not connected. Yeah. So you changed jobs, let's say.
I changed jobs,
Very good.
Yes.
Sorry for the takeover. Okay.
Yeah.
So, good. So, my name is Jorge Fernández. I'm the Chief Innovation Officer for Hospital Clínic Barcelona, which is one of the top 30, top 45 hospitals globally, according to the Newsweek rankings. My mandate is to drive innovation across the critical institutions we have in the organization, what we call the Campus Clínic Barcelona, which is the hospital clinic, the public hospital, part of the Catalan health system, our research foundation called IDIVAPS, our global health foundation called IS Global, and another private foundation we have for being more agile called Clínic. And of course, as you can imagine, we have plenty of data down there in probably more than 400 silos that Jorge was mentioning before. So really looking forward to the conversation today.
Perfect. I think we'll start super easy, just to break. Challenges is heavy, but when we think of innovation within health, why do we care?
Gosh.
Why do we care?
Yeah,
What?
I mean, I care, to clarify, but I think for the masses, why do we need to have that emphasis? Why do we need to have that discussion? Why do we need to engage the public as well in that discussion?
I mean, this is a complex and a simple way to approach it, but to me, this has both efficiency, geopolitical, and economic reasons behind that. And the first one, it is basically, I will try two reasons, the main reasons for me. One is we just have a great healthcare system here in Europe, and unless we do things to make it more efficient and do more things with less or the same things with less, we won't be able to pay for it, and that's an important thing. And this is something dear to our hearts, because as Europeans, we think this is part of what makes us different from the US and China, okay? And that's part of also the welfare state, part of our societies, so that's really challenging, okay? And then, of course, if we look at towards the patients, because we can practice medicine in better ways with new technologies, and that's not ethical, to just stay in the 19th century or the 20th century practicing medicine the way we did, but we need to step up, and it's not just hospitals or other organizations, investors, the government, we all need to step up to make this situation a reality for patients and for citizens alike.
Yeah.
Great.
I mean, just to add perspective there, if we go back to 1920, and I'm giving sort of UK data here, there are approximately 20 working people for every 3 retired people. Currently, it's starting to approach the exact opposite. So the level of retirees now close to 20 for every 3 working people are contributing taxpayers, very soon moving to 2. So, you don't have to be a very sophisticated economist to understand that that system won't be sustainable. And on top of it, you have the healthcare challenges, which are it's simply not enough people in the system to be able to address all these challenges. So something has to give, and has to give very quickly, or else we're really facing a catastrophic situation in the delivery of health. And the vast majority, at least of the NHS's budget, goes towards illnesses which are already towards late stage of disease, and that's where the majority of cost sits. So the premise of the question is, we know that prevention strategies drive significantly improved health outcomes, but we know that that takes a very long time as well, because you're trying to shift behavior, and up until now, we really haven't had a lot of data to be able to prove that through an evidence-based way. So whenever you approach the finance committees or treasury departments, usually you'll say, this will save you billions in 20 or 30 years, when they're thinking of timelines which are only 2 to 3 years at a max in terms of economic policy. So the good news is that there's been a lot of change in how this is taking place, but fundamentally we're going to have to shift, in my belief at least, accountability and ownership to make the consumer the CEOs of their own health. So how do we transfer agency back to consumers, and how do we give them the right information and tools to be able to make the right decisions at a very personalized level? We all know that smoking is bad for you, but if we're able to translate that into a very specific individual in terms of what it means for you based on your own genetic makeup, based on your clinical history, then potentially that can also start shifting behaviors. And how we think about that as well in terms of precision medicine and precision health, which is, again, what our future health is aiming to do, is by providing an ecosystem where innovators can come and interrogate the data to drive their own models, or life sciences organizations can drive research, or academia, or government, or technology companies. You start to potentially unleash what has really been missing so far, which is doing things in a secure way, providing innovation back to people, and hopefully making a dent in healthcare. But innovation is required very much, again, for the reasons that we said before. We've seen it across other industries, but still yet, let's say, an elusive target in healthcare.
It's an uphill battle, isn't it? When I think challenges within health, 3 immediately come to mind. Tech, red tape, obviously, and money. Of those 3, what do you think is the worst?
As a barrier, you mean?
Yeah.
The 4th one.
All?
Which is, so let's say people, okay, for 2 reasons. One is we have old mindsets still in the system, right? That's number 1. Number 2, sometimes when we want to innovate, our people, our clinical teams, they don't have enough time to innovate, right? To innovate, there's very few people who have free time to, change reality, transform digitally the organization. So that's a challenge for us, right? So that's the second one, right? And then the third is our inabilities to work across silos, but across disciplines, right? It's very difficult my job is mainly to talk to people that I just don't understand the languages that they're doing, but I do a little bit more than the others. So the lawyers, the economics, the physicians, the nurses, the IT teams, etc. And that's a challenge. And those who do it, those are nodding their heads. They know what it is, right? And then of the other 3 you mentioned, certainly to me, money is really a big one, right? Because that, of course, the other 2, regulation is terrible. What was the 3rd one, sorry?
Tech. Barriers within tech. I think it's a timing thing, in my view, when it comes to tech.
No, tech, I'm super happy with it. I saw tons of startups every day that I would love to incorporate into the hospital. So, no, tech is not a problem, I would say. I think it's how do we make them interoperable? They talk to each other, as Jorge was saying before. That's a challenge. But tech per itself is our, let's say, our we are thankful that it's here, let's say, as a driver for change. But I think it's the money, right? We don't have enough money in the systems either to incorporate or to scale, right? Because really, scale is really our challenge,
Fair enough.
Yeah. I mean, I would echo, people, I'd say I'll call it culture, because ultimately culture touches regulation, culture touches people, culture will touch technology. Money, of course, is an issue, but I'd almost put that secondary, and I'll explain what I mean by that, is I come across so many people that have wonderful ideas, but it's just so hard to get started. Where do I go? How do I access the data? How do I deal with the regulatory environment? And so fundamentally, our risk appetite needs to change, and it needs to change quickly. And there are pockets of excellence that create innovation hubs where you create these cross-collaboration ecosystems to try and speed things through the ecosystem. But we're still again in a phase where I think that's quite a difficult area to tackle. In the case, again, of the UK, regulation will always lag behind the level of innovation. It's just a fact, and that's something which is I think we're gonna have to deal with for some time. But if you remove that, because I think the risk is that we always say we need to wait for a better regulatory environment before we start bringing change. And then I think we're going to be stuck in this thing of like never moving really forward. Is how can we operate within the environment that we have to move as quickly as possible within certain guardrails? And we've seen already the benefits of some of that playing out with application of AI for different types of use cases, particularly with imaging, some of the interoperability that we've already discussed. But I would argue that if we could just let people get on with it, and have their ideas and provide a support structure to move them quickly through that process, we're going to get a significant amount of change out of the system. I think financing, of course, will always be important, but at the same time, if you give the NHS a few more billion, I don't think it's really going to be a noticeable difference to the patient.
Agreed entirely. I think if we build on that conversation line where we consider where is the money, we see a lot of public and private relationships go through. Maybe it depends on your market. In your experience, what you've seen over the past few years, what's the best investment strategy going forward? Should you seek non-dilutive funding, engage with government bodies, or should you really go out there towards the venture guys, us, and sort of dive into that at the risk of potential sort of dilution down the line?
So we have close to 30 spin-offs in the last 15 to 20 years, right? And I think if I look in these 15 to 20 years, the strategies have been different. But I think the answer is all. We need money from everybody and to do everything, right? So non-dilutive at the beginning is very important because it allows us to, create values on those companies, in those companies, right? But, a lot of them, we're talking about, advanced therapies, AI, different things. It requires a lot of money. So it's needed that, we get money from the people. So when you say, where's the money? I guess you have it, right? So it's
some of the money.
Some of it, you have it. That's good. So we'll talk at the end. That's one. But also we need to talk because there's also public money out there, right? And sometimes there's public money from the Catalan government, but also there is public money through the European Union coming to the Spanish government and the Catalan government, and we can do things there, right? So that's an important topic. However, I have to say that, very much along the lines of Andrew, money alone is not enough, let's say, right? And then the NHS is, recurrently on the newspapers, and for me it's a shock to see them on the Financial Times all the time, which is an economic newspaper. You see NHS all the time there, right? So it's really strange, let's say, right? So indeed, we need more money, not all the money possible, but I think we need to find one question that we haven't asked ourselves is who needs the money and who should channel the money? These are two important questions, right? For example, if we talk about our German colleagues with the DIGA, let's say the money, goes to the startups through the connection with individual doctors, let's say, right? Has worked well in some cases and not in others, right? There are other models out there. Should we look into this model for ourselves? Mm-hmm. Should the money go to the hospitals, So we force them to change acquiring, services and products from the startups, Should it be to collaborative projects, which is the EU approach, Mm-hmm. So to me, this question requires some further research to understand what is better. But certainly we need more money from everybody and in collaborative ways.
That's super clear. I think there's one big emphasis that we hear time and time again is also, or an area we need to emphasize on, is community health. We need to be engaging with rural areas that do not have access to that healthcare. And in terms of funding, those are pockets of environments that we don't see a lot of healthcare, a lot of funding go into. What strategies do you think can be creative to incentivize people to really pay attention to these areas?
Yeah, I mean, I'll pick on the example again of our Future Health here, because one of the premises of the program and why it got support from the government was, up until now, health data sets and programs have been significantly skewed to certain population types, you know, whether it was age-related, sex-related, or simply, you know, wealth-related. So what we wanted to do with our Future Health is build the most diverse data set that would match UK census data, which would be quite important then for population health level strategies, which means you have to engage the community in a very different way to collect that, because ultimately what we've asked of the 5 million people that we're aiming to recruit into the program is to give us their most precious data, their health data, to give us not only, you know, that through blood samples so that we could do their genotyping, but also to give us all their phenotypical data, their NHS health records. So to do that, we have to give them something back. And that something back has to be health insights that is going to help them fundamentally change the outcome, the health outcome over their lifetimes. And that's quite a very special contract to do with people, and to do that across demographics, across different groups. And so far, you know, thankfully, we measure this against the UK census data. We've been able to match that quite closely. Fortunately, the principal investigator on the program has been very driven to do this in the right way. But I think, you know, again, back to the community engagement point, it's not something that you could say, we did it once and it's over. You have to stay connected with them. You have to keep them engaged. You have to give them back insights. They need to feel the what's in it for them over time. It's not just about, here's my data, I hope it will help the future research of the UK, but how is that helping me in making better decisions about my health over time? And then translating that back into, well, translational research, real world evidence, which is what we're hoping. And, you know, we'll be able to talk about this, I hope, in a couple of years, is can these 5 million people start to have significantly different health outcomes than the rest of the UK population? In other words, what is the level of pre-diabetics now in that population as opposed to the UK population? How has cancer pre-screening changed in that population versus the rest of the population? Their cardiometabolic outcomes, whatever those might be. Then you really start to have a very good proof point to all stakeholders involved to say this is something really worth investing in. It's translating into savings. And again, you know, back to the money issue, you know, the NHS has, you know, over 120, 130 billion pound sterling budget. That's quite a significant amount of money for about 120, 130 billion sterling.
It's heavy.
It's heavy, yeah. And that for a population the size of the UK, you would think that that's a pretty decent financial envelope. So there's a lot of systems, culture, you know, the things we've discussed there before. But if we could prove this with this cohort, which is what we're aiming to do, it's the largest healthcare data set out there now. I think then we could really hopefully start to replicate that more broadly.
That's brilliant to hear. And I think if we build on the points that you've mentioned, collaboration is clearly key for pushing a lot of innovation in this space. And when we think about cross-sectors discussing, in our own fund, we have a lot of fintechs that blend with healthcare companies, and we create this wonderful little insurance play and so forth. But what do you think the secret sauce is for getting other sectors to come into health and attract them into what some dub is a very risky space?
Let's say in terms of talent, I see more and more people wanting to come to healthcare. Why? Because, I mean, whenever sometimes I interview people and I ask them, so, okay, people with MBAs from top schools, and I ask them, so what is your career so far? And they say, I've been doing marketing for, I will not disclose the company, but a tobacco company, right? And, well, you know, you feel it's not what people want to do with the rest of their lives, okay? And they want to enter healthcare, let's say. And I think also because, and I think that's why, you know, we're all in healthcare, we see that there is potential to change this, right? And then human beings are attracted to the potential to change things and to move them to a better place, right? You can call it moonshot, you can, call it, American discovery, you can call it whatever, but that's the idea of we can transform things, we can, do for better, which is in the end not for corporations, but for citizens and patients and families, etc., right? So that's one thing. Then the other, of course, is finding ways to collaborate, right? For example, I see fintech, as a great learning opportunity for us in the financing space, right? So we need to learn how to finance things, better ways, these guys, they've been doing it for ages, right? Some of them, even the insurance people, they get the revenues before they get the costs, which is very unlikely for us or in all the other industries in the world, right? So I think we can do things there. However, I think the challenge is to find one or two. Always, I think it's a matter of finding one or two to start building the case, because these cross collaborations are not easy to run. Let's say at the beginning, you can do things, for example, with postal services. They have locations all over the countries, right? You can do things with space industry. There's tons of things. So there's lots of things that call for cross collaboration, but it's a challenge because it's easy to find the right intersection.
Agree, and you touch on space. I think we've seen quite a few space tech companies using satellite to deploy healthcare with really remote areas that do not have that internet sort of infrastructure, and maybe building on your point. Is there an area within health that there's an untapped sort of partnership waiting to happen that maybe we're not exploring?
I think that if we just rewind 10 years ago, we wouldn't have heard of the types of companies involved in healthcare as we have today, right? I mean, it's just very clear, that's now happening, whether it's, Google in the technology space. We have, loads of startups. I found quite interesting when the opening, when the question, I was sitting in the front, so I didn't see the hands, when they're asking who's from the health space and who's from the tech space. I'm hoping that question in a few years' time, everybody will be raising their hands for both questions, because they should be entirely intertwined as we go forward, as we think about it, because they're both going to have to be part of the solution. So, I mean, in terms of like big things that we still need to resolve, I think those are fundamentally coming together. We talked about interoperability. There are data standards that are now helping us achieve that, how we bring together data silos, how we connect data. But fundamentally, I still think that the culture of how we look at this is going to be very, very key. I mean, I'll give you just sort of one example of what I mean by that. I would assume that most organizations that deal with data will have security as probably one of their top risks, that they need to mitigate. And the challenge with having security as your top risk is that it's factually correct. You don't want your data to leak or end up in the hands of nefarious actors. But at the same time, the more secure you make that data, the harder it is for other people to be able to use the ecosystem. So there's a trade-off there that you need to manage. And ultimately, how you manage that usually comes down to a few subject matter experts that are providing their view on what you need to do. And those subject matter experts might have quite a different risk appetite profile to what the organization is trying to do. So how you think about balancing that becomes really key. And I know I'm off piste in terms of like what's the big challenge in healthcare, but I think we need to fundamentally get over this hurdle of how are we going to deal with data? How do we make it available and useful for others to be able to really leverage the advantages of it? Because unless we cross that Rubicon, it's going to be very difficult for us to fully exploit the benefits that it could bring.
Without a doubt. I think I did a mini interview a couple of weeks ago where they were asking me sort of, if you had a magic wand and you could fix one thing within health, what would you do? And my view was very much like, could we get one sort of standard quality controlled version of what data is? I appreciate we have genetic data, metabolic data, and various different forms of data, but if there was a unified sort of standard so that it can allow interoperability and transferring data very, very easily and very well, we would be miles ahead, like we see other cross sectors are. And I suppose I'm throwing the question now to you. If I could give you a magic wand to address one of these various different challenges that we have within the health space, what would you hit first?
This is really magic, right? So what you just said. So I hope I'll see something before I die, let's say, right? So, but it's really challenging because the last 20 years hasn't happened. If I look, for example, at what is happening in Catalonia and in Europe, in other places, here we are still putting a lot of effort onto the physical structures, right? And I think, and in these days we're opening lots of, or will be opening new physical buildings, new physical infrastructures, which is good in general, right? But I would like to see more money, more effort, more strategies going onto these things, right? And I think I'm looking into Jorge, because I think Jorge is the one who's having more important work doing that in the future. So if he and others do that correctly, I hope that, in a few years' time we'll be, in places that we're not today, right? But that's the challenge. To me, there's 2 points in time where we'll be extremely happy if that happens, right? The first is that all our data are digitized in a safe space, secure, compliant with laws, etc. Okay, this is when I talk to my colleagues in Israel what they have. Okay, so I mean, if they have done it, I guess that we can do it. It's not, it's nothing impossible out there. That's one thing. So that would be a day to open the bottle of champagne. A second one would be if we are able to scale one thing. Okay, just one thing, because we have thousands of things that work, thousands of innovations that work and that work well, and our challenge is, to be able to have it across, right? So to me, I guess to your question, my magic wand, how do you call it?
The wand, yes.
Whatever, I cannot pronounce that, okay? So that magic thing would be along these two lines, money to try to scale and these, let's say, alongside what you're saying, this unique data space where, we can play things internally, externally with others. I think that's where we could, really trigger the change out there.
Okay.
Yeah, I mean, I totally echo your point. Maybe I will add one, which is, can we envision a future where we as individuals own our health data and we can take it anywhere we want? Regardless of location, regardless of language, regardless of anything, where we have access always to that data. Two very recent stories to share. I recently moved in London from Chiswick to Twickenham, which if you've ever been there, it's a 10-minute drive. And I signed up to the new NHS clinic, which is part of the process of moving your house. And it's literally like I landed from outer space. Nobody knew me, and I had to fill in like 10 forms, all the information that I'd provided a couple of years earlier to a clinic that was just 10-minute drive away, to a lady who I knew was going to be retyping all of this into a computer, or even worse, putting it in a folder in the back of the room, never to be seen again. We're still there in some cases, right? And very recently, chest X-ray, and I got it in a CD. Right, a CD.
Okay.
Okay, it wasn't in England, to be fair, so I won't disclose the country, not to not to bash anyone.
Please.
No, it wasn't Spain either. So
No, I was not being here.
So but who has a CD-ROM? Please, does anybody have a CD-ROM here? Can you raise your hand? Oh, I see one person. Wow, two. Wonderful. So I guess there's still a market for it. But whenever you want to sort of access that, forget it. It's not going to be accessible. So can we have that in our hands? Can we have all that information? Really have our longitudinal data being captured, integration with wearables, all that kind of stuff? I think really starts to now with AI, and particularly Gen AI, start giving us a lot better insights and agency over our own health. In addition, of course, to the points that you mentioned around interoperability and single data standards, which, with FHIR we're getting there, but I think it still needs to be significantly enhanced.
Agree. I moved house 3 times over the past couple of years to different areas. I can confirm it's a very paperwork-heavy process that needs serious updating. It's really depressing. That being said, maybe finally, something we always like to be conscious of in the investment world, hype within the health space, out of interest, maybe as a concluder. Is there an area within health that you think is overhyped and maybe getting too much attention that is absolutely not necessary?
I'll answer the first question without the not necessary. I think there's a lot of hype, on AI, it's nothing that I cannot, I'm not discovering the world now. But I think there are other areas where there is hype as well. We can say from remote patient monitoring to certain, telehealth tools that are there. If these days, for example, I would say these translation services of the conversation between patient and doctors, there's lots of places where tech, is overhyped, okay? And I don't think this is a bug. This is a feature of the evolution of technology. We know how technology evolves, the classical, Gartner cycle or other cycles. There are ways where this happens. And at the beginning, this is what happens, right? I just hope that we are able to transition faster to that. But I don't know, are there any other?
No, I would agree with those. I mean, the AI hype obviously is a well-founded hype. I think there's a lot that's going to come out there. But the question that I used to get asked a lot at Google was, will AI replace our jobs, especially from providers?
Yes.
And sort of my answer to that is for the next 10 years, I think it's fundamentally just going to augment. But I will say that healthcare providers that don't adopt AI will be replaced. So that would sort of be my takeaway on sort of the hype with AI.
That's a good one, because I was really curious about that, and I did work with McKinsey 3 years ago when I was at EAT Health, and what we discovered, we looked into all the medical specialties, right? And we looked into, there was not going to be taking jobs, but certainly certain tasks and activities will be taken off by automation, and it should be. Nobody wants to do these transcriptions that doesn't make any sense, let's say, right? So indeed.
Yeah, makes sense. I'd love to maybe open the floor to the audience. If they have a question or two, please raise your hand. Please, go ahead. Oh. Do voice projection. I appreciate it's early.
There we go.
It works now, yeah.
It's just me. My name's Martin Evans from Unboxed. It's not so much a question, but an observation when you're talking about risk. And how do you begin to communicate the fact that not changing the status quo is far riskier than some of the changes that seem to be appearing more quickly than people are comfortable with? The benefits of change have been laid out, but still people feel like change is risky, rather than what we're currently doing, keeping data locked up in silos, for example, is incredibly risky and causes problems all the time, but people don't see that risk as important as the risk of change.
I've used this logic before, but it never worked with me, let's say, or let's say with the people that I talk to. The two tools that work for me better is others are doing it, right? It's human beings, right? That's the first one. And then the second is potential opportunities for making things better. So calling the higher call in individuals rather than the cost, right, of being left behind. Or this, in my case, it has never served. Maybe it's because I'm not good at that, let's say. But I haven't managed to convince people that, by staying as we are really risking a lot of things, right? Only when there is a big crisis, and of course, like COVID or other things, and things move super fast, but not because of commitment. That's my experience so far.
Yeah, no, I mean, I would agree with that, and it goes back a bit to culture as well, and that it's unbelievable how people fundamentally resist change, right? Because when we say, a system doesn't want to do this, it's not necessarily because the computer won't do it, it's because the people don't want to do it, or you just have too many naysayers as a part of the process. I mean, honestly, I think the thing that's driving the biggest change is not necessarily like this willingness to adapt. I think it's because of the burning platform. I think that's what's driving the change. People know that it's breaking and it's collapsing, so you have to do something. It's forcing the change. It's unfortunate because it's not like we didn't have a warning sign saying, hey, listen, this is going to happen in a few years. It's so clear. And I think the issue still is that despite the burning platform, I think the system fundamentally still runs a risk of collapse. So what is encouraging, I think, is, back to the AI comment, where probably a few years ago, again, in conversations that I used to have as a Google employee, would be, AI is this, thing that's coming. There's no real use cases for it yet. Now, most academic institutions are adding full semesters just on artificial intelligence for healthcare providers, which is a huge step forward. I mean, this is, saying, guys, we know that this is going to be a part of your future way of working. So I'm hoping that if you could get those, you could get the bright shoots coming up of what others are doing, have other countries leading the way. Mm-hmm. We have countries, Singapore comes to mind. Obviously, what we saw today on Catalonia is also a great example of, places that are able to do it by solving things in a different way. Hopefully, we don't run into the, yeah, but that wouldn't work here type answer that we tend to get whenever we're trying to drive change. But super, super complex topic, certainly, and, not an easy one.
Yeah. Immediately what comes to mind is always education, conversation,
Yeah.
keep it going. I think you have to scratch away at people to get them to the level of understanding and seeing that reason. But I think we're heading towards the right direction, so it's super encouraging, but aligned completely with our panelists. And there's a really angry red 5-minute overtime, so I'm going to have to leave it there with the risk of disrupting the conference schedule. But I'd like to thank you all for your time and listening.